I'm a member, Doug, as well, volunteering some time with Humber River. I'm sit on the philanthropy board at Humber Memorial.
Thank you for that.
Your name comes up because you're a big supporter.
Yes.
So I thank you for that. And your name comes up a lot when we speak with small business owners in Ontario. And we mention your name. They say, oh, I speak to Doug. He helps me out a lot. If I have a problem, Doug Ford helps me out. So you work, Doug. You help small business. You are pro-business. You understand a lot. And it's absolutely brilliant. But let's talk about healthcare. Canadians, I don't think, truly appreciate this free model that we have isn't so free. All of the equipment in a hospital is funded by donors and local communities, businesses. They don't appreciate that, the importance of funding and supporting your local hospital. You do. Right. Can I ask you, can I throw it over to you, what work do you think you can do to help support Humber this year, Doug? Because I do know that you're there.
Well, isn't it funny you mentioned, because I just talked to Barb Collins, the CEO, and Joe Gorman, had a conversation about building their capacity to handle a lot of people coming into emergency departments. And to be very frank, Wolfgang, half the people that go into emergency departments shouldn't be in the emergency department. They should be down at a clinic down the street or down the hospital hallway there. Little Johnny cuts his leg, and he's in there. I spoke to a lovely person the other day. She called me up, said, I went to Niagara Hospital, there was a 4-hour wait, and then I went up to Welland. There was another 4-hour wait. It's unacceptable. And I said, ma'am, can I ask you what's wrong? She said, I have a really sore throat. I told her, I said, that's the problem right there. But we're pouring unprecedented amounts of money into healthcare. But if you look at worldwide on the chart of HiFi, that's the organization, per capita, we're putting more money in, but the output is a fraction of our counterparts in the U.S., and we have to deliver healthcare differently. We've increased the budget by $33 billion. We've hired 13,000 doctors, registered 100,000 nurses, and $50 billion into new hospitals and additions to hospitals. But I've told the CEOs, I've had them all in the room and saying, guys, you got to look at lean methodologies. You got to come up with a better way at delivering healthcare, because the time I spent in Chicago facility and our New Jersey facility, you go to the hospital, your butt sits on that seat for about 2 minutes and you're moving.
Oh, they take care of you. They so take care of you. Kudos and thank you for the efforts there. And I do know that you have a lot of influence on business, and business has benefits to giving back to the community. ESG, right? Environmental social governance is real. And so there is a partnership taking place between the corporate world, the government bodies, and our local hospitals throughout the province. It's a very important initiative, and I am proud to be a member of it.